No idea.
Welcome back, everybody. All right, we're gonna jump right into Rhyme and Rhythm as our spinal workshop for the start of April 2024, and it's really about time, frequency, intensity in our health and healthy living. So I'm Dr. Kristen. Thank you for joining us here at Monarch Family Chiropractic out in our community as well as here in the office with us. And we are gonna jump right in. So we talk about as chiropractors that we want to understand what health is and a healthy body and understand how things go together. You know, we talk many times about how just because we feel well doesn't mean that we are well on the inside, that, not to merely diagnose diseases, but approaching health with what does a healthy body do? What's a healthy environment? What are the components that make up what we're spending our time doing, right? And how we create an internal environment, basically, right, as we are the host, so that it is unable to be, incubated disease as readily, that we are strong from the inside. And many other workshops we've done talk about salutogenesis, and, we talk about the, or salutogenesis too, and the component of between that and what pathogenesis means. And Doc covered this not too long ago in one of the other workshops where it's talking about, what is health and what is sickness and a diseased state. But we really want to talk about in terms of our health, where are we going and what are we driving for? And so when we look at the two side by side, pathogenesis is really a starting point for disease or a problem. And a salutogenesis is really how chiropractors practice and naturopathic people in that holistic field of health. What is your health potential, right? We want to look at, we're going towards health, not away from it. If we're going away from it, we're going towards disease, right? We're going towards a problem. So we don't really sit at this necessarily homeostasis. We're either going this way or this way along the continuum. So when we look about salutogenesis, it's really like our starting point is our health potential. The goal is really maximizing the expression of that health potential, right? What we're working towards is creating health factors, really, and that the perspective we're looking at is to obtain health, not necessarily to just treat a disease. Our focus is really promoting gains or growth in our health. And so we've got to set some goals. We've got to know where we're at, so we know what we want to approach and what the goal is, and that there's continuous improvement, that there's not this point of just status quo. We're just going to sit here and maintain. It's one of my least favorite words is maintenance. I don't want to maintain necessarily, or stay in a place of just stagnation. So I understand sometimes what people mean by that word. I think that we want, we're wanting to maintain good health, but we're wanting to, I feel like, do more than that, have continuous improvement. And it could be small pieces. It doesn't have to be large, huge gains. Sometimes people get those and then just expect that they're always big gains. But if we're in that continuous, pendulum up, then it's really not so much of this teeter-tottering or coming back down or yo-yoing through. So if we're really trying to, in one end, focus in pathogenesis on, the minimization of problems, in salutogenesis, we're really looking at the optimization of potential, right? So the motivation is to be empowered and put empowerment into our patients and our health and what we know, not necessarily motivate by fear. And so again, that profile looks, instead of like we're just dealing with episodes of something happening, we're dealing with progress and a process over a lifetime, right? So we talk about lifetime care. We want lifetime care for everyone. That is our goal here, Dr. Mike and I, is so that someone's having care from beginning to end of life and all phases in between. And so an outcome is really showing the presence of a gain, not just an absence of a problem. And therefore, usually a practitioner's role is as your partner in your health, not your kind of this dominant, I feel like, instructor that is just do what I say and how I say and when I say to do it. So kind of recapping that, I think is good to look at how we look at health before kind of diving into the other components. So what are, time, frequency, intensity? We talk about what are our commitments towards things. And I think this slide is very interesting, that just drives straight home. People know that there's a time frame that we must do things, in a sense, if we are overcoming or making a commitment in time to change something and its intensity. And so it could be a number of things, from a surgery and what that looks like and rehabilitating that, or working on a factor of, if we're in a phase of wanting to change our body dynamics, our weight, our heart health, our all those types of things. We think about if you've had any cardiac events or you've had anything where that's been anywhere from recovery from bypass surgery to you're starting to have heart that is working harder, or we're trying to lose weight and take pressure off the body and the heart and the joints. I mean, those all have time, frequency, intensity commitments to them, no matter what they are. I mean, just even thinking about the whole birthing process and the process leading up to, right? It's all those types of things that we have commitments towards in order to get there. Our health is no different. Oops, I think nope, I didn't skip. So we've done lots of topics when we talk about where our health is in America. We talk about what sick of a nation we are, even though we're the most, technological superpower in the world. We don't rank high in health, but we've gone over those types of things of like what is, in a sense, killing us in America when we talk about, right, the pathogenesis side, like the disease state, whether it's heart attacks, whether it's cancers, whether it's, different components like that. It's really when we choose to do a similar activity over and over and over, or make an uninformed, choice or decision, whether we know or we don't know. I guess there's a difference that definition, right? Stupidity is kind of that uninformed choice. We're just doing something over and over again, not knowing any better or learning any better. I think what they call, use other words for, choosing to do something over and over repetitively. Discipline is really what we want to see in a positive way that really creates freedom for us in our health. And so, when you're learning to live in the discipline of whatever it is you do, and taking care of your spine as one of those things, taking care of your body, then, you're learning to have freedom in more ways in which you use it, more ways in which you've been able to do things. So, Doc has this statement in here that there is no virtue in trying to study what got you to be a ruined wreck, right? What got you to the place you are. We want to look at where are you showing up and how do we, go in that trajectory forward. So that consistency is really what's going to create more of that freedom and really into that better health. So as long as we're breathing, as long as we're here, we have that potential, right? And it requires that responsibility to do things in a different way, to create the healthy body that we want. So when we talk about time, we talk about principle number 6, and it's that there is no process that does not require time, right? So it's hard in this day and age because we all live in this very fast pace. We live in an environment where, probably every third commercial is something that just talks about how it can get you to some other place faster. Technology is amazing. And yet when it comes to your health and your health care, there is a component of by the time we're looking at something, what is that timeline for true healing? So, you guys in the office may know that as what your care plan looks like, right? This is a time component. Is it something that hasn't been there as long, so it may take us a few months to make change and then lasting change? Is it something that has been there for years to decades that's going to take us an initial 9 to 12 months just to start changing the patterns of the nervous system, the patterns of the body, what your body understands as health, and then start to live from there versus the state of possibly disease or unhealthiness that it's been in? So, and how long we talk about that we need to take care of our spines? Well, for the rest of our life. We get one, and there's not a replacement for all those parts and pieces in modern medicine. And so we have to think about what we're doing earlier on so that it has the longevity to get us into those 80s, 90s, 100s. And so we kind of want to not necessarily look at playing small, but really how do we get into a different type of big picture that you get, small pieces of wins and recovery and quantities of that, and it gets you to that next level of the next, what's the next step, what's the next goal, what's the next step, what's the next thing that's driving us. So it's different for everyone. And what's different is that we have all the same parts and pieces, but how we use them over the course of our life. So that's going to be very different for one person to the next, even if we're the same age. So there isn't a process that doesn't require time. Frequency is really looking at all things, right? The frequency of your care plan, the frequency that you're doing any component that's going to give you that repetitive input that is changing a pattern and changing the brain's pattern and changing the neurology and changing the musculature and changing everything about how your body gets there. And so continued care and a frequency is also very different for everybody. Everybody may start out at a higher frequency because we just need more input if we want to get there faster and get the body winning over the repetition it does in other facets of what you do in your life. So continued care can be something that I term transitional at a period of time when you're getting out of that initial phase. You're in a different place of, okay, the body is learning patterns and doing different things, but we haven't transitioned it back into doing maybe more activity now in this more mobile body and body with less pain, or and then moving into supportive care, which is really where a frequency may change, but we're giving you, or you are doing other things in outside of the office or in your life that is creating the momentum of support of like, okay, maybe going back to walking so many miles, or going back to the gym, maybe going back to adding in an exercise and activity, maybe adding something new, right? So as we're going into transitioning of the body doing better as healing, once we're out of pain and we're more mobile, then people start adding activities back in, or a new activity they never did because they're excited they can do it. So changing supportive care is always can be a slippery slope in some ways for people because they feel so much better, right? And we just are trained in our brain in Western society that means I'm healthy, that means I'm good, that means everything's gone, that means I'm healthy again. And we have to watch, because as we start adding in new things, we're changing patterns, we're creating new patterns. And that frequency is very important to just getting you on the other side of not only having the mobility, but the stability to do those activities again, right? And build up ligamentous and muscle tone again, and strength and stability. So maintenance is, again, a word that's used in our medical culture a lot. It's not used in this office very often. I rarely ever say it. And it's just that because, again, they're all different and that looks different for everybody. But maintenance care to me would be, in this day and age with the technology and the stressors and the things that are going on, and I think in our world, especially in the last 4 to 5 years, that's somebody that's doing every other week, once or twice a month, or less. That is really just barely maintaining maybe some of the mobility and the movements of the body, but not really taking it to the next level or playing at that higher level there. We talk about frequency in the office, and that it takes so many years to see degeneration, aging, osteoarthritis, things like that, to show up on disc disease or the joint disease on x-ray. So once we start seeing it on x-ray, we know it's been there usually 5 to 7 years or more. And again, then there's phases of that, as most of you, if you've seen your x-rays, have maybe you're somewhere between phase 1 and phase 4, right? And so it's not really where our healthcare begins, right? It's where crisis care begins. Healthcare really begins at birth. It's when we really are starting things on in that early time frame, so that, again, we are doing the most right things for our bodies from the get-go, and that's training them in a very different way than someone who starts this training in their 30s, 40s, 50s, or beyond, right? So when we say no missed appointments, we talk about that because it's all about consistency and frequency over time. So it's just about moving those around to make the most of the visits and the most of the care you get over a period of time. Everybody has breaks, vacations, things that come up. And so I think when we talk about frequency, it's really that there's that dynamic of it's over time. If we do more in one area because we have gaps of others, that's usually still a really good place for the body to gain momentum and continue to grow. When we talk about intensity, then it's really, what are we doing? What is our intensity, and at what intensity are we playing at? And so, what intensity, when you look at from what we are doing what we do on our preparation for intensity in chiropractic is that it's just not showing up and unlocking the doors and saying, hey, we're happy Monday. We train on a daily basis. We train every Tuesday. We train monthly with hundreds of other teams once a month. We go and travel 3 to 5 times a year to train for a full 2 to 3 day weekends and preparing for delivering, better care and service. Doc and I spend another 2 to 3 weekends on top of that, doing lots of other outside continuing education credits. So it is the intensity we play at to deliver the best care and the most appropriate care for you and your family, whether it is our couple-week-olds or somebody that's in their, 80th decade. Right now we have a couple people that are right around 87, 88 in the practice, and it's really been awesome to see the changes they've made in just small pockets of time with having had some pretty good challenges for many, many decades. So, how we prep and start our day is really what can lead to the intensity of that day, which leads into the next, which leads into the next. So I don't have the video necessarily that we're going to play full out with this, but something that Doc and I have implemented more recently with some training that we've had in playing to our potential and increasing our intensity is I guess I would say an exercise called priming. And it's something that I've got a YouTube link in here, and Kayla, would I be able to push it and play it? Okay. We may be able to see just a few seconds of it, and I'm hoping I might be able to scroll through so you can just see what the intent is. It's a 10 to 15 minute process that starts with some really purposeful breathing to get blood flow and oxygen into the body and the brain, and then going through certain affirmations and going through things that really set you up individually with the things you care about and the things that matter most to you for success for that day. And to, again, play with intensity. I don't know anybody that just says, well, I feel like I really just want to get by. And yet that can be how we play if we start our day really unintentional and maybe without a game plan or without any thought into what we're trying to accomplish. So everything that we bring as far as intensity in the office is really, when we're doing a lot of our trainings, how to bring that intensity to you all and how to get the most out of what you're doing. And so when we go through such a thorough day 1, day 2 of processes with all of you here, it's because we want to understand as much of your timeline as possible, as much of your story and history, because if we can then give you more things like this, what the workshops are for is not for us to get up here and you hear us just chit chat or to, just to talk. It is really to give you information that if we know that there's things that improve you making more educated decisions, you are just going to propel in your health even more because you're going to take more action and you're going to put more intensity around the purpose of what it is your goal is. So whether we have our WOW articles on here or reading material or our Pathways magazines that are all about families and babies and birthing and natural care for families from beginning to end of life, the extraspinal exercises, things to be doing in and out of your workouts that are part of your healthcare. The things even that we have at the kids station is all around the coloring, and the books are all around chiropractic phrases or statements and learning parts about your body. We want that information for our kids early on. We want them to understand and know how much power there is in the decisions they can make for their health. And even just having an open room adjustatorium where you hear other education by things that doctors sharing with another patient or sharing, with you helps somebody else that maybe hearing or being, having similar questions to you. So it's just a good place of learning. And so we'll see if we can get this to open up. Oh, right. But this priming that we learned is an exercise that Tony Robbins has done for a very long time. And really what I want you to see is that there's a process, and I'll see if it'll let me, taking through just where you are focused on what is, he says, remember, you are the creator of your life, not the manager of your circumstance. Priming yourself, decide what to focus on. And so it goes through a component of really looking at the set of breathing and doing these 3 sets of 10, and then going through, looking at thinking of a moment that you're most grateful for. And we usually go through about 2 or 3 of those. And so going through a second moment, and it's really just putting yourself in that moment. Is it something with your kids? Is it something with your spouse? Is it something with a big monumental event that happened in your life? Something from early in childhood, your favorite place to vacation, your favorite person to be with, whatever that is. It's putting yourself in that situation, or in that place, or feeling, if you will, and then just expressing kind of that appreciation and gratitude for that situation, whatever that is. And so it's really looking at different components of how to support with gratitude, how to be what, brings you passion, what you're compassionate about. And, it's really looking at overall things that matter to you, as this says, the real you, right? And it's stepping into those things that bring you purpose. So there's a lot of pictures that go through this as they play this one. I've actually never looked at it because my eyes are closed when I do my priming, because I'm in the moment and I'm such a visual and kinesthetic person that I'm visualizing exactly where I was, what I was wearing, who I was touching, what experience I was having when I go through my 3 memories. But if this is something that, you've never done before, I would encourage you to just YouTube, Google Tony Robbins priming. And then Kayla, going back to, take me back to that. Let me see. Oh, there we go. Good. I think I feel like I already am. I don't know if I'm still in a different mode there. So with that, it's something that I would encourage all of you to take on. If that's not something you've ever done, is take 10, 12 minutes and Google it you can put it on your phone. You can just look up any of that on a search engine, on a laptop, on a portable device, but be at a place where you can be still. You're not doing it while you're driving. You're not doing it, while you're multitasking with something else, but see if that's a piece that you can up that intensity, and think about it, what that means to you. And lastly, we're going to talk about the consistency, right? It's not that as soon as we feel good, things are healthy. It's a dangerous place to be because we aren't feeling as much. And so we think that it's improved, or it's improved enough that it's better. We tend to fall out of good habits and back into older habits. So as long as you're part of our team, that is our part of being accountability partners for you. And part of your healthcare team is that, again, through that salutogenesis model, we're here to support you. We're not here to boss anybody around. This is your healthcare, your choice to be in this space and getting educated, to make the most right decisions and better decisions for you and your life and the ones that you love. So consistency is just key. And I don't think there's a whole lot that any of us would probably balk at to say otherwise. That is what drives results in any facet of life, and especially in health. And so, as it says, the rhythm of life never ends, right? So when we talk about, there is a difference. What's normal versus what's common? And that's something Doc talks about a lot when she slows down into workshops and talks through what that means, and talks through, just because something's common doesn't mean that's normal to have. It just tends to get normalized because it's very common to have certain conditions in our country, right? Nobody thinks twice about that. Doesn't mean it's normal that that's the way in which our society lives, or the way in which our society is dying, and ailing. So it's really, there is a difference between those two things. And I would say if nothing else, step into recognizing, is this normal or is it just common? And helping just your own perception of those words and those meanings and what that means to you. Again, time, frequency, and intensity is something that will always be there, isn't something that we can necessarily avoid. And so we really want to make our choices wisely, right? To benefit greatly. And we're really honored to be part of your health and your family's health and partnering you in that goal you want to achieve. And so if there's times we push you, if there's times we reinforce something, if there's times we ask how many times you've done something at home outside of here, it's because we just want to see you make it to that next goal level and continue up that trajectory instead of plateauing at a place that's of less excellence. So I'm going to end with that there, and just a call to action of who do you know who's maybe living in a situation that's common, that they think is the way their life is supposed to go, that they think that's the way their health is supposed to be, and you know differently that it's not. And that's not necessarily a normal place that someone needs to be in a day-to-day or week-to-week, month-to-month. And I would encourage you to connect them with their closest chiropractor to them, even if it's people that are not here in our neck of the woods. We have a huge community nationwide. And so we get emails all the time and asks of patients for family and friends and people in other states. And we have a nice resource to go to at least find a point as close to them, and then defer to our experts that we know across the country and who they would recommend that's closer to that area. So know that the network is there, even if it's not here in Denver, for us to be supportive. We can support in many, many ways. And that's how we build the strong, amazing community that we just all deserve to have. So with that, thank you for joining us tonight on Tuesday and spending your time with us talking about rhyme and rhythm of life and time and frequency and intensity. And I challenge you to let us know what that next increased level of intensity is for you. And share with us how it goes, either whether you try the priming or some other version of a piece that helps support you in upping that intensity for a healthier, happier you. Thanks so much, and we will see you next Tuesday night. Bye-bye for now. Very good.